name is Maria Uribe. I'm in my scrubs. Here's my student ID. I'm going to be doing the NG tube skill today. So I'm going to introduce myself. Hi, Mrs. Jones. My name is Maria. I'm going to be your nurse today. I have a doctor's order to give you an NG tube because they're concerned about not having anything on your stomach. So we're going to aspirate the gastric content. This procedure is going to be a little bit uncomfortable, so we're going to work through it together. You might start to gag and cough. Just raise your hand. If you need a break, you can take some deep breaths, and I'll give you some water along the way. So I'm going to provide privacy, perform hand hygiene, get my gloves. So right now I'm going to inspect your nose, and we're going to decide which side we're going to use. And I'm also going to measure from your nose to your stomach to see the length that we're going to use as well. I have all my supplies, the NG tube, my basinal warm water, lubricating jelly, absorbent pad, some tape, pH testing cup, my light that I'm going to use, and the piston syringe, and also some water. So, can you confirm your name and date of birth? Perfect. I'm going to raise your bed to high Fowler's position, and I'm going to inspect your nares for any abrasions or deformities. Everything looks good. I'm going to occlude one side of your nose. You're going to breathe in deeply. Okay, I'm going to occlude the other side. Breathe in deeply. Okay, the airflow is strongest on your left, so we're going to use the left side. I'm going to measure from the tip of her nose to her ear and down to the xiphoid process, which is 50 centimeters. So I'm going to mark the 50 centimeters with tape. Mark it with tape. And put the tubing in some warm water for now. Make sure she's in high Fowler's. I'm going to put the absorbent pad across her chest. So Mrs. Jones, remember, this is going to be uncomfortable, and you might start to gag and cough, so just raise your hand anytime you want to take a break. We'll take some deep breaths, and I'll give you some water. So make sure the lubricating jelly's open. It's open. And I'm going to, now that the tube is nice and warm, I'm going to lubricate the tip of the tube. So I'm going to follow the natural curvature of your nose. If you could just tilt your head back, I'm going to start inserting 5 to 10 centimeters at a time, following the floor of her nose toward her ear. She starts to gag, so I'm going to advance a little, stop. She raised her hand. I'm going to let her take some deep breaths, drink some water, advance 5 to 10 centimeters. Tilt your head forward, drink some water, 5 to 10 centimeters. If at any point I'm at resistance, I couldn't advance this tube anymore, I would remove the tube, relubricate it, and try the other side of her nose. So drink some water, 5 to 10 centimeters, drink some water, advance 5 to 10 centimeters. And we're at the 50 centimeter mark now. So I'm going to tape the tube to the bridge of her nose. I'm gonna twist, wrap around the tube, wrap the tape around the tube. to secure it in place. Alright. So X-ray team is going to come and check for placement. And how I'm going to check for placement, I'm going to aspirate some stomach content. $10 milliliters is enough. So I'm going to test it with the pH strip. pH strip reads 3.5, which indicates it's in the correct placement. Chest X-ray team came and also verified it's in the correct placement. So I'm going to pin the tube to her robe. And now that I know it's in the correct placement, I'm going to connect the tubing to the suction canister on the wall. I'm going to note the stomach contents coming out, which I see green bile fluid, 20 milliliters at the moment. And I'm going to take off my gloves, perform hand hygiene, lower the bed to a comfortable position. Are you comfortable? Okay, make sure she's comfortable. And I'm going to document that the NG tube insertion was successful, was verified by the X-ray, verified by the pH strip. I'm going to document that I connected the tubing to the suction canister on the wall and the suction began. That I'm going to document the patient tolerated well and isn't in any pain or discomfort right now. I'm going to document I used 50 centimeters to get to her stomach, 50 centimeters of tubing to get to her stomach. I'm going to document that I confirmed the placement and the amount and the texture and color of the drainage that's being suctioned out which is green bile, 20 milliliters at the moment. So I'm gonna make sure she's comfortable, also document that she's comfortable, and throw away the supplies. Make sure her bed is down, and that is it.